Well, good morning, good afternoon, and good evening to everyone, depending on where you are. I am honored to be here. For the purposes of this today's discussion, I decided to call this. I decided to pivot a little bit and rebrand this particular talk to "Innovating RWE Organizations: Learning from the Past and Looking to the Future." What I hope to really do is discuss how we need to reimagine the biopharma RWE functions to better enable clinical discovery, development, and the commercialization of drug therapies in a post-COVID-19 world. Just as a disclaimer, all of the ideas and views here are expressed on my own, and they're not necessarily representative of AbbVie or any other company that I'm affiliated with. And if you do want to certainly receive a copy of this deck, you can. Just let me know, and I ask that you kind of let me know if you're going to be redistributing it accordingly. But just a quick word about myself. I am a Dallas, Texas, born and raised. I am a husband, father, huge Dallas Cowboys fan, patient advocate. I spent the majority of my career actually, at this point, mostly in health systems, but also in biopharma, consulting, and nonprofits. I moonlight as a professor at NYU, and I serve on many boards, both we'll say public boards as well as nonprofit boards. And just a little bit about AbbVie for those of you who may not be as familiar. In 2020, we posted 45.8 billion in revenue. Of that, 5.8 billion were actually in R&D spend in 2020 to support the continued pipeline growth. We have 60 programs in clinical R&D, 30 products in mid and late stage development or under regulatory review. Certainly an important fact is that last year, $50 million were allocated to support many of the social justice issues and contributed directly to philanthropies that positively affect Black communities. And as far as the size of the company, we're roughly 47,000 colleagues in total. But just when it comes to the social justice, I just want to opine on that a bit. Really, when AbbVie thinks about it, and this is all public information, so it's posted on the website, there are really four elements to it, and one of which I've already described, which is this actual contribution to many of the sort of Black philanthropies. There's also a concerted effort around clinical trial diversity, obviously diversifying the workforce, and really just being certainly much more of a public voice on the issues around racial justice and being a model, hopefully, for not just other biopharma companies, but companies generally in all industries, as how a corporation can actually embody diversity and inclusion and really elevate the discussion and really take some actionable steps to addressing many of these problems that we widely recognize are there. So if you get a chance, certainly check out the letter that was penned by our illustrious CEO, Rick Gonzalez, and you can actually see some of the key initiatives that AbbVie itself is involved in when it comes to this issue of social and racial justice. But in light of that, and in light of one of those pillars that make up the EED&I strategy for AbbVie, the key thing that I want you to know is that when we think about diversity in clinical trials, it really truly does mean good science plus better medicine. And so, there's obviously been some ongoing debates around the significance of the relevance and importance really of diversity in clinical trials. And I think that it's been certainly it shouldn't go understated that the pandemic has certainly served as a lens and really put a spotlight on this issue around diversity in clinical trials. And hopefully it serves as a catalyst for change in many respects so that we don't find ourselves in this situation again. But just some parting words for you there. Now we're going to jump right into the talk, and really the focus of this is around how do you build this very forward-thinking RWE function in hopes that and using many of the sort of silver linings, and there weren't many, but silver linings that and lessons that we learned during the pandemic to further institutionalize in your organization in hopes that you can build a much more progressive organization. I think that prior to the pandemic, there were attempts by many pharma companies of establishing, chief digital officer, chief data officer roles. I would say with relative to relatively limited impact, I would say. But hopefully, when with this COVID-19 cannonball, we can see many of these digital and data transformation efforts really take shape and really start to be incorporated into the overall strategies of biopharma companies. Because, as I've said many times, for those of you who may have heard me speak before, is that I think that the biopharma industry is certainly ripe for disruption if we don't disrupt ourselves. So, in light of this sort of COVID-19 cannonball that we've been faced with, our wrecking ball, I should say, cannonball, COVID-19 wrecking ball, where is the biopharma biotech industry headed, and how can RWE leaders keep innovating to drive the organization forward? Now, one of the key aspects of this talk is really around looking back in order to understand where, and then looking forward in order to understand what we can learn and glean from the things that we've done, as well as looking at how the industry and the whole healthcare ecosystem is taking shape on a global level, and how do we position a highly effective RWE function. It's just like any other function, it needs to evolve as well. And so for the remainder of this talk, we're going to talk a little bit about emerging trends. We're going to talk about things that we learned from the RWE function, as many of us have established those functions in our various organizations, and the way that we should start positioning this particular capability as we go forward, and just my general thoughts on how that will ultimately evolve. So if you think about some of the key advances in medicine over the last 25 years, we've made tremendous strides in the life sciences world. We've had the Human Genome Project, we've had targeted cancer therapies, there's been the precision medicine revolution, there's been obviously this ubiquity of informatics and digital health and health data. We've seen better incorporation and use cases of artificial intelligence. And now, there's much discussion around effectively using 3D printing. And so when it comes to advancements in technologies, it has, we could say over the last 2.5 decades, there has been tremendous strides. And it makes all of us super eager about what is to come from, for the next 25 years. I actually, and so in light of that, I actually took, this is a screenshot actually from University of California, San Francisco, where they talked about their predictions and what they thought health and medicine would look like in 2050. And if you look across the different quadrants, you'll see, the game changing versus overhyped and the fiction versus prediction. But if we were to go to the upper right quadrant, you'll see where, practically speaking, they believe things like that will be addressed is such as the eradication of AIDS, cell and gene therapies, obviously greater interoperability of systems. You can see some of the key advancements that are being that are really starting to take shape. Whereas, things that are a bit overhyped, but could actually happen. You see a picture of our good friend Jeff Bezos and Amazon and how they've will infiltrate the healthcare system. If you jump to fiction and overhyped, you can see, that really it's, and I know this is very small print, so it's not meant to be an eye chart, but generally, I'm just trying to give you a sense of how, some of the great thinkers and great minds are thinking about what health and medicine will look like in 2050. And as far as we know, many of these things can happen much sooner than we think. But when it starts to come to a little bit of my perspective, I generally think that you'll see certainly increased DNA sequencing. Right now, we're looking at, some of the experts are projecting that we'll be at roughly 60 million genomes by 2025. Obviously, there's a continuous expansion of the use of digital technologies, which allows for mass phenotyping and the longitudinal data, and looking at things, certainly understanding the effects of nutrition, health, and disease on individuals and certain subpopulations as we get in much more into the precision therapy, which is my last point on there. But another point that's worth noting is around, and that we've seen over the last several years, is the digitization and virtualization, basically the cloud computing capabilities that allow for larger data sets. Now, where this becomes extremely important is, if you think about it, during the pandemic, we've seen increased activity with global data sharing, which is something that we want. And you really get the you really get the full appreciation of if we were to share data globally, um, the speed at which we could move with addressing some of the world's most prominent and prevalent diseases. We could all, it's like a shared vision, and that we're all working towards, and it could do much better for the public good. But according to the fourth industrial revolution, this is I think one of the best quotes to encapsulate where we are and where we're headed. And it reads, the healthcare industry is faced with the challenge of incorporating simultaneous advances in physical, biological, and digital technologies, as the development of new diagnostic approaches and therapies coincides with the push to digitize patient records and capitalize on the wealth of information that can be gathered from wearable devices and implantable technologies. And so, where you're looking at it, as we just discussed, you have obviously this explosion of genome sequencing. We see an explosion of digital technologies, which allows us to get data much more passively about people in their everyday life and their environments, and so on and so forth. And also the further integration or interoperability of these various systems in order to get bidirectional information exchange, and so that we can create the longitudinal record. So there's just a wealth of data and information that we can explore. And there's been a number of studies that said that we're analyzing less than 5% of this data that's available. So we don't know, and I think that one of the key things that we'll have to think about as we move forward is this: how do we start to reframe our questions? We have this wealth of information, but yet we're asking still fundamentally the same questions we were asking 10 to 15 and 20 years ago. So I think that part is pretty remarkable. But hopefully, with the better incorporation of many of the advanced analytical capabilities, we'll start to ask even better questions, or I think more appropriate questions that will give us greater insight. So why is RWE especially appealing today? I think many of you probably already know there's been such a regulatory push, and for many of the big pharma or life sciences companies, you typically don't move unless the regulators say it's okay. And obviously, we're seeing all the regulators globally really express strong interest and preference in some regards with the use of RWE as a complementary evidentiary base. And so that will only continue to grow in interest, as we get more success stories of where RWE has been appropriately used. Obviously, we've seen, even in the last couple of days, the release of some RWE as it pertains to the vaccines from both Pfizer and Moderna as far as their effectiveness in a real world context. So you can see the power of RWE, and I think that it's becoming much more common knowledge than it was, say, 5 years ago. There's also the second thing is that there's an increase in the availability of data, which we've talked about extensively: the clinical, biological, the real world structured, the unstructured, and other data. But I think the power really comes in that ability to really look at that unstructured data that we're just kind of feel like we're at the very genesis stages of really exploring. And that's all being empowered by point number 3, which is obviously the significant advances in AI and many of our predictive modeling capabilities, and this idea around knowledge management and other technologies that we're seeing. When it comes to the RWE functions, though, it's interesting because I've obviously having established this a few different times now. You can take different approaches, and I think that it all depends on the culture, leadership, and preferences of the organization. Some people generally start off in a very federated state, and I think that if you're highly federated, it usually is more. What I found, in my opinion, is that it probably shows where you are on the maturation continuum when it comes to certainly the how organizations are thinking strategically about the use of RWE. It's certainly there are pros to it. Usually, one of the key pros or positives of it is that you're much closer to the business. Because in fact you are a part of that business unit or franchise, and so therefore, when it comes to the understanding and appreciation of those priorities, you're so close to it that you're actually a part of it. The problem is that it gets very limiting when it comes to scaling many of those learnings and those insights. And, generally, you're only going to go as far as your resources will allow you to go. And so considering that, many companies have thought about, well, they don't have an abundance of resources to build many RWE functions across the different business units, they move to much more of a centralization or centralized approach, which is generally in the form of a a center of excellence. And what this does is, it allows for greater consistency, quality of the analysis, and you get that knowledge sharing under one roof. But even that can be a step removed from the business, and depending on the culture of the organization and the leadership and how they've promoted and pushed this establishment of the COE, can be somewhat rate limiting in how effective you can be. What I think the world will shift to is ultimately a hybrid of the two, where some people refer to it as hub and spoke, where you kind of get the best of both worlds, where you do have a centralized knowledge sharing capability, but then you also have those units that are somewhat dispersed in the various business units of different parts of the business, but they're somehow interconnected. So it's very much a networked approach to how you think about it. And that if you get to that stage, you really are starting to institutionalize the use of RWE. I always think of COEs as being catalysts, not permanent solutions. And if you are, and if you are somebody semi or quasi permanent solution, then you are generally, you're really not advancing the use of it as much as you could be within your organization. So there are some stats from the Deloitte Real World Evidence Survey in 2020 that I thought are pretty relevant about the way we should be thinking about certainly the expansion of the RWE function and capability within biopharma companies. And the first one here is that 94% of survey respondents that participate in the survey are using RWE and R&D. They believe using RWE and R&D will become very important to their organizations by 2022. So that's basically saying you're looking at green space or blue ocean opportunities. It's in R&D. The second point is that survey respondents expect a shift in the appreciation of RWE in the next 2 to 3 years, with the highest impact being in R&D, including supporting regulatory filings and augmenting clinical trials. So not just clinical trial optimization, but augmenting clinical trial evidence with RWE. The third point, most respondents expect a wide range of benefits from using RWE and R&D. So far, the biggest gains have come in the form of cost reduction and post-marketing commitments and executing clinical trials. So again, been primarily used in much more clinical trial optimization, sort of operations fashion, where it be site selection, patient recruitment, those sort of activities, which are very much important, but there's certainly greater opportunity on R&D front. The fourth point, 70% say that a lack of research-grade data is hindering RWE efforts in R&D. This emphasizes the importance of establishing strategic partnerships. More than 80% of surveyed companies are entering into strategic partnerships to access new sources of data. Now you're starting to get into this world of how should we be thinking about the ecosystem? How should we be thinking about our data partnerships and data accessibility, which is going to be key. And it doesn't, this is not to undermine the the data partners that we all have today, but it does mean that we will have to be much more strategic and opportunistic in how we think about data, and certainly much more intentional as RWE becomes much more of a strategic enabler. The last point here is almost all companies expect to increase investments in talent, technology, and external partnerships to strengthen their RWE capabilities, which is getting into this world now of core competencies. And how do you build a partnership ecosystem where you know that you can't do everything, and you certainly can't be good at everything, but you find vendor partners that complement your capabilities and that allow you to, I don't want to say, dare I say, outsource, because it's really a strategic partnership that enable you to do your work certainly much more efficiently and effectively than you have in the past. When I think about RWE functions and how they've evolved, I have this outlined as past, present, and future. And when I think about the early days of these RWE functions, and I think about it being mostly a data sourcing and procurement sort of organization, I think about an organization that was focused on portfolio management. And what I mean by that is that you wanted to identify all of the RWE-like studies in the organization and somehow create a portfolio that could be certainly to show senior leaders and the type of impact that's being made utilizing RWE. I think of an organization that was focused on identifying best practices and certainly trying to disseminate those best practices to the organization. And then I think about a group that was leading many, many, many pilots, almost to the point of being in pilot purgatory, as I like to say. But if you jump to the present and where we are, at least hopefully where most people are, you see increasingly this discussion around talent and community development. This notion that we need to hire more data scientists, folks outside the industry that can push and elevate our thinking. You see this idea around establishing enterprise operating models, where gets into this whole idea of where we are versus centralized and the hybrid or hub and spoke approach. You also start thinking about technology enhancement. How do you create centralized repositories or central analytics platforms that allow for the establishment of coding libraries that we can be shared, and so on and so forth. And then more importantly, you also get into this idea of how do you identify high value use cases. In the past, it was very opportunistic. In the present, it should be on what use cases will ultimately drive the business and have great and meaningful impact to the business. But if you jump to the future, now, and I've alluded to this already, where you're seeing is a world that has novel partnerships and focused on advanced RWE capabilities. That means applying advanced analytics to RWE generation to deliver impact at scale. If I had 5 strategies for any of you who are particularly interested as you think about RWE leadership, I would break it down like this. I would say leaders are actively deploying strategies to elevate their understanding, accessibility, and communication of RWE value drivers to the enterprise with high value use cases that I just alluded to. The second, I would say leaders are establishing agile and operating models that drive adoption and integration of RWE across the pipeline while developing risk mitigation plans. The third thing I would say is that leaders are deploying rapid, cost-effective data analytical platforms that can democratize the use of data and analytics at scale. The fourth thing I would say is that leaders are focused on developing and or expanding robust partnership ecosystems. The fifth, I would say, is that leaders are thinking about ways to shift the expanded use of advanced RWE capabilities and the recruitment of high-performing and diverse talent to achieve that success. And as I mentioned before, really, if we're not thinking about this as certainly a cross-sector partnership, as a ecosystem that involves everyone, then certainly you're doing yourself a disservice. This is no longer the biopharma or life sciences sector operating in isolation. We have to be interconnected to the other sectors within the industry in order to really achieve what we ultimately want to achieve in this space. One of the great quotes I love, and I love Thomas Davenport for many of you that follow him, great leader in the thought and the thinking around big data and analytics. But he was quoted several years ago saying that every company has big data in its future, and every company will be in the data business. And that's across industries, that's across sectors, that's across functions. And so you're best suited to think about how you use data, certainly much more strategically than we have in the past. Pharma is the biopharma industry is certainly behind many other industries when it comes to this. But I'm hopeful that we can elevate our games and certainly be leaders in the space.